everyone, and welcome to the Healthcare Quality Risk Matters After Show. Today's topic, we're talking about proactive versus reactive uh, risk management and quality management in your healthcare organization. If you haven't seen it, you can catch the recorded version here on our YouTube page, on our LinkedIn page. Link can be found in the description and comments section below. And Timothy, can you make sure that those links are there?
Absolutely, yes. I'll put that in there.
So I'm Gary Bierce. I am the CEO of Aperitisoft Healthcare. With me is Rob Santamore, our Chief Operating Officer, and Dr. Timothy Brown, who is our Senior Vice President of Customer Success. Between the three of us, we've got decades of experience in not only risk but quality and healthcare administration. And at this after show, we like to dive in a little bit deeper, and we're willing to say things a little bit more boldly here. And yeah, we're going to talk about our software product in this segment, because we believe we can tackle these problems very, very well if you've got the right software. So Rob, I'm going to start with you. We kind of posed a big question back in the live show of what if we took the same amount of emphasis that we put into bedside care and trying to be proactive there with how we're managing risk and quality in a healthcare organization.
One, we would just
don't hold anything back, Rob.
Yeah, so we have all of the information that we need. There are many other very successful industries, and healthcare is full of very educated people. We know how to be proactive. We just don't do it. And if we were, we would save more patients, which is the main reason that we are in operation. And two, we would be much healthier financially. There is so much waste. If you're literally flushing 15% of your revenue down the drain because you refuse to invest in time, people, and solutions, there's technology to solve your problems by being proactive. I have no sympathy for the organizations that are suffering because of poor risk management.
Timothy, I got a question for you.
Sure.
Do healthcare organizations have the right systems to go proactive?
That's a loaded question. Do they have the right systems? They have systems. Do they have the right system? No, they do not. What I mean is they have multiple broken systems that if you piece them together, they may be able to identify the information that's needed. However, who has the time to be able to decipher through this information? Mm-hmm. And the manual process that goes into it leads to very many errors across the board as far as data management and control. So no, yes and no. Yes, they have multiple systems. It does not equate to what we can offer with the Aperitisoft Healthcare, though.
Agreed. Timothy, when you are, I just want to expand on what you said, because I heard a lot of things in that ignited a lot inside me. So we have sometimes 5, 6, 7 systems that we are using to create a whole system in order to do, there's minimum required reporting, capture minimum required quality data, there's minimum required efforts post-incident. And in those, there's softwares, you're requiring people-driven processes to move information, analyze information, or share information. There's from software solution to software solution to software solution to software solution. And I'm saying software solution loosely. Really what I mean is a fancy Excel spreadsheet or Adobe form. Mm-hmm. There's,
they are systems. They're an Adobe form, but they are systems.
Right. And so it is very frustrating trying to manage quality, risk, and compliance in healthcare. There's, as we all know, and many of our listeners know, because we do not have the right technology. We have technology so advanced there's in healthcare that somebody can do. There's surgery on the other side of the country with a remote control from the living room in their pajamas. But we don't invest in a solution to make sure that when something with that system goes wrong, that we know how to respond to it, or heaven forbid,
Make sure it doesn't go
it from
wrong.
going wrong in the first place.
Correct.
And so, yes, these multiple systems that we have just piecemealed in all of these Band-Aids don't make sense to me from a healthcare standpoint. As healthcare providers, we don't use Band-Aids to fix giant gaping wounds.
Well, let's dissect that or unpack that a little bit more. Okay. So what we're saying is that most of almost all healthcare organizations are running off of something they might call an incident management software tool.
Yep.
They might go a little bit broader and say they've got a healthcare safety tool that they're working with, which is principally the same thing, but might include some CAPA management to it, where the incident management doesn't really give you the corrective action capability. It just identifies and lists what those incidents are.
Right? Or it claims corrective action capabilities because it gives you a narrative box.
Right. To say what you did, to say what you did about it. Or there's others who try to claim they're integrated and with quality and safety, or in some cases they'll say risk and safety, risk meaning the incident side, which is again reactive. None of them are providing ways for you to take your proactive actions and document them in one place with the same system so everybody can find it. And none of them have the ability to do proactive risk assessment work on multiple levels, right? Except Aperitisoft Healthcare. So we have given a healthcare organization everything they need to not only handle what the historical view requires, but to then get ahead of that and be proactive. And the reason why is the software was built from an enterprise risk management perspective from the get-go. So it is already following the universally accepted risk management process and deploying that in different ways, whether it's reactive or proactive, or whether you're dealing with compliance to different audit requirements. It's all in there. It's baked in there. So to truly get ahead of, and we had a great question from Dan Toll in the live show, for those who may have listened, where Dan was asking, well, how do I get management to do it? Well, one thing is you got to show them you can, and with the right systems, you're capable of making it happen. So I wanted to get that plug in because it was killing me during the live show. That it really gets down to even the systems out there are not wired to do this.
So they're not, and it's the Band-Aid method that is honestly, it's a 4-letter word in healthcare. When you say I'm going to put a Band-Aid on it, you will see people get up in arms. They get really annoyed because they don't want processed Band-Aids. And frankly, I don't know that when I was on the floor that the nurses station even had Band-Aids. Wow. And like actual physical Band-Aids. We don't use them in healthcare. Those are things for your home cabinet, and that is where they belong. There's healthcare, there's needs, there's strong fixes, there's for things that did go wrong, and not if something isn't working, I'm just going to keep piecemealing it together and add Band-Aid on top of Band-Aid. No, you're eventually going to have to take it to surgery. You're going to have to do reconstruction, and you're going to have to sew them back up, and you're going to have to put a nicer face on it and do some plastic surgery to fix that so you have a return to baseline. And that's what we do for people. We acknowledge the necessary steps that we need to do for people. But for our operations, we forget that. So if we have a spiral bound notebook that we've been using to record our CAPA management, well, let's buy a CAPA management process or software. Well, now we need something to do our audits. We're going to buy an audit management software. Now we need something to do our document controls. We're going to buy document control software. We just keep adding Band-Aids.
Right.
In the second they get wet, they fall off. It just doesn't work. It's not a solution. It is a temporary fix.
Now, there are organizations out there, and you know of one very personally, I know, Rob, that from the top, they are told you're going to use this particular system for your risk management.
Mm-hmm. Yes. There's actually a couple of them, but yes.
And management is, look, I agree, it's broke, Rob. I believe it's broke. But you can do any kind of things to make things better, but you can't change the system.
Almost the exact words from that leader. Yes. You need to get everything fixed, but please don't make any changes.
Well, I mean, look, if you're out there and you're stuck in that situation, know that systems like Aperitisoft Healthcare can give you all those benefits you're looking for and can adapt in a way where you can still run on that platform. So that platform can still do its thing that the group is looking for, but now you can start getting some real benefits out of your quality and risk program. Don't ever feel like, you're stuck. There are ways. And particularly Aperitisoft Healthcare, we're an affordable tool that will fit perfectly within your budget. Just need to seek it out.
Well, and it follows the healthcare model, right? So like the oil industry, not a healthcare model. There's Toyota, not a healthcare model. Those are manufacturing steps that start their quality at different parts of the quality process than healthcare does.
Yeah.
Healthcare, we should be proactive, and we should always be starting with assessment or identification. We're either being proactive and we're assessing and we're gathering data and we're making informed decisions about potential risks. Or something has been identified because we missed it. Or honestly, life happens. And things do happen, and we acknowledge that. But we need to assess. There's proactively or identify, and then we can start. There's evaluations, investigations, evaluations, and start moving our way through. There's the actual healthcare process. So Aperitisoft Healthcare was built for the healthcare process.
Exactly. Yep.
And whereas the other ones out there are piecemealed, so you can rearrange them. And ask the data to move from one point to the next, to maybe adapt to your process, or you are asked to adapt to your process and just there's ancillary documentation to support the healthcare process. Yeah. And it doesn't even, I have a hard time articulating it because it's so jumbled. It doesn't make sense.
Okay, next question for you guys. When you think of this topic, proactive versus reactive, right? You take a moment to think about this. What really burns you? I mean, what really ticks you off about this topic, and why hospitals seem to be stuck, or healthcare organizations seem to be stuck? What is it that really aggravates you about this?
Okay.
You just spoke.
I need to. I want to go. Yeah, there's two things that really burn me out. One being there's no clear definition in healthcare, and maybe there's a written definition, but no clear understanding of what quality really is and what it does for the organization. And I think that is
wow.
Yeah,
I mean, that's so fundamental. I mean,
that is the basis of what we need in order for us to move forward. We need to, number one, define what the issue is. We tell people that go through different processes, the first stage of anything is identifying what the real issue is. And I think it is identifying what do we define as quality? What do we define as proactiveness for an organization? Because that can mean different things, as Rob said earlier, many different steps in this overall process of being proactive. They can infiltrate many different avenues. And I think for every department that needs to be defined, and that starts, to me, and I always go back to it, the culture of the organization. You have to build that into your culture, which is the second thing that irritates me. We don't have strong cultures in healthcare, other than those that go from the understanding of this is the way we've always done it.
Mm-hmm.
Strongest.
No, that burns me. That comment always burns me.
That is the strongest understanding of culture in healthcare. And that really just, it irritates me to the core, because we'll never get out of this cycle of making real positive change until we get out of that understanding that this is the way we've always done it and it should always stay this way. Everyone sees it. You can ask your employees now in your organizations and say, what's the biggest thing that needs to change? And they can give you 100 reasons, and they all go back to a more proactive approach for building out your overall culture for your organization and a proactive approach for the work that they do on an everyday basis. There are things that we do that just don't make any freaking sense across the board, but we still continue to do them. So,
They keep right on
um,
doing
so that those are the two things that burn me. I have many
it.
more, but
Okay, good. That's
give it
awesome.
up to
That's
Rob.
awesome. Now, Rob, you're over there having your Horseshack moment. You're asking me, well, what's Horseshack? What are you talking about?
Yeah, I don't know what Horseshack
Okay,
is.
well, there was a sitcom when I was a young man, high school age, called Welcome Back, Cotter, and there was a
Never
character,
even heard of that show.
and there was a character named Horseshack, and he would go, "Ooh, ooh." So you have to, you're ready. You have to tell me. So tell me, what is burning you about proactive versus reactive in healthcare?
So Timothy aligned very well on. He said almost everything that I would have said and expanded. There's further in many directions because there's so much to say about that. So thank you for.
Yeah.
I feel very heard. It's like yes, there's same page. There's but I would also say the fact that quality is not a revenue protecting or generating function within the organization. One of my favorite mentors that I've ever had, he was my COO, absolutely brilliant. There's phenomenal leader. There's did amazing things for the organization that I was with. And he told me my team, when I was running quality risk and compliance, would always be understaffed because my team is not billable.
Mm-hmm.
And I spent the first few years of my quality risk and compliance career believing that we were firefighters. Our job is to mitigate things that happened. My job is to protect the organization from lawsuits. There's sentinel events. There's from bad press. And essentially that was it, right? Regulatory and accreditations and things like that. But that was my job. And even a man that was brilliant didn't understand the value that quality could have had. It wasn't until my next several roles and me growing in my career and growing in learning from there's many people, including there's you two, there's Gary, you've really done a lot with teaching me about cost of poor quality. I feel like, especially in the last 4 or 5 years, I have really understood it even at a deeper level than I did before coming to Aperitisoft Healthcare. And I wish that they would get it. I wish that they would understand that quality saves so much money and generates so much money because of there's our value-based contracting, which is where all of healthcare is going. We've seen a trend. It's happening. Every single healthcare facility has some type of quality metric they are accountable to in order to get paid. Nobody just blanket gets paid anymore for turning over a patient bill. I did a service, I get paid. It's not a fee for service model. It's just not anymore. And so my pet peeve, quality has a financial function within the organization.
Okay, you ready for my pet peeve? My pet peeve is management. And it's not just healthcare. I mean, guys, this is in just about any industry group. When you put up the word risk management or quality management, it's like their brain has a switch and it switches to, okay, this is something I have to do. Keep me out of jail. Keep me away from this. Keep me away from that. And they don't even want to listen to how they can turn it into a positive. They can turn it into an opportunity. They can turn it into a competitive advantage just by connecting a couple dots. And the cost of poor quality is one of them. That understanding that, look, yeah, we are accruing or spending 15 to 40 million dollars a year because of poor quality, and it's just the way it is. Well, no, it's not just the way it is. You took
Mm-hmm.
a tiny fraction of it. I mean, a tiny fraction of it, like in investing in Aperitisoft Healthcare, along with some good instruction on how you tackle the holistic view of risk, quality, incident management, safety, all in a integrated fashion, and you're going to see that you're not getting hit with fines anymore.
What a thought.
You're not wasting time on staff having to scramble to deal with surprise audits. Right? You're not dealing with poor metrics coming through that are affecting the payers out there and how they're paying you.
Mm-hmm.
You're not worrying about that anymore because now that money is free. So you want to invest in that new wing, you want to invest in that new equipment, you want to expand staff, you want to add beds, tackle your quality problems.
Correct.
And do it proactively. And you can fund it pretty well. There's my pet peeve.
I love all of that.
That's good.
Yes. The liability, financial impact, quality is honestly not even well measured. We can measure it in Aperitisoft Healthcare. You start with us, right? You can establish a baseline and you can capture all of your data. You can see how much your cost of poor quality is. And then you can see how much you're saving over time.
Yeah.
And in what service area, right? You know that your ED is always going to cost you more in poor quality. It's just gonna.
Yeah.
Mm-hmm.
And patients have a right to their own care, and no matter what you do, sometimes they're just going to jump out of bed and swan dive face first into the floor because that's what they're supposed to do because they wanted to, and they have a right to do that.
Right.
Well, it's still a sentinel event, and it's how you document that, though. Whether or not that nurse and that doctor would end up having to sit in front of a medical review board, lose their license, get sued, or the hospital is going to be, hey, patient X chose to swan dive off of the bed.
Mm-hmm.
And we did all of the appropriate things ahead of time. So we're good. That was a patient choice. And that happens. If we don't have that documented, we wouldn't be able to protect you.
That's good.
And that patient's going to win. They're going to walk away with a big payday. You're going to get a mark on your license.
Which means it's got to be easy to document. I mean, the reason why it doesn't get documented is because it's hard.
And so that is
true.
Why you want systems like Aperitisoft Healthcare, which I don't know if there's any other one really like us, is that we streamline that process, make it easy for you to get the data into the system from the people who shouldn't be doing this for a living. No. And the people who are doing it for a living have everything at their fingertips to drive through the process and then manage everything to conclusion and be able to report to management progress. And hey, let's get proactive. Let's do a risk assessment. Let's do a preemptive audit prep, going through the entire CMS regulations and self-assess ahead of time.
That's right.
What a thought.
That should be what quality, risk, and compliance spend their time on, right?
Yeah.
Compliance should be designing the blueprint. Here's what we have to do. Risk should then be going through and assessing what are our risks. There's if we do or don't do certain things, right? And here's the data that we have. There's very thorough assessments, and then quality should be putting in controls to make sure that identified risks are well controlled and process improved, and that we have controls to ensure compliance. And that we're getting good data and performance improvement measures. It's really simple, but it's not simple when you're having to take that concept that has a lot of graying and spider webs of overlap, right? In trying to put it into forms or spreadsheets across multiple functions that for some reason we have value streamed inside of a hospital and made disparate. And it just doesn't work. You need a collaborative, comprehensive team, and you need a smart solution that can do it all for you.
Yep.
Yeah.
So, Timothy,
Yeah.
you get to ask the last or put up the last topic for discussion to wrap up the after show. So,
Sure. Well, I mean, how do we get the left brain to talk to the right brain? And this goes back to our leadership team. How do we make the jump or the leap, if you want to call it, from quality being an afterthought to quality being a proactive approach in of an overall organization? And I'll leave that open to you both, and I'll give my final thoughts after you express
Okay.
yours.
Hey, I need to get the final word on it then. Let me tackle first, Rob, on that. My experience with risk management. Now, this may be different than working with healthcare organizations, Rob, but you've got to get a win. God, management wants a win. They want to see something that proves that what we're saying is true,
Mhm.
right? So whether it means you're just looking at the emergency department, or you're just looking at the lab, or you're just looking at the pharmacy, and you take this proactive view there and watch the metrics change.
Mhm.
Watch it change and get everything ready to be quantified ahead of time. Bring that to management and say, look at the difference. It was costing us this in the pharmacy. Now it's costing us this. What did we do in between? We took a proactive view. We got them involved. Now, please allow me to roll this across the entire organization.
Mhm.
You know, that's how we would do it in risk management. Now, that may be too basic, too simple, too financially organic than healthcare like to think, but that's the way we would do it in the risk management world.
That's great.
I like that. On I would say it's also just that return on investment piece and getting them to understand it. The challenging piece is they don't associate, and I say they, hospital leadership,
Mhm.
in my very many conversations slash professional disagreements with them on this. They don't understand where the costs that are going out the door in the garbage are quality issues.
Mhm.
I hear so often that's a personnel issue. I hear very often
Interesting.
that was a vendor issue. I hear there's is I mean an HR concern, right? Like I hear all of these excuses of what the actual issues are instead of saying, okay, all of these things that aren't going well, all of these things that didn't go well, all these things that cost us money that we have to throw away are quality issues.
Mhm.
There's
Yep.
people inherently don't do the wrong thing. They just don't. They know they can get sued. They know people's lives are in their
Right.
hands. They're not purposefully going around hanging the wrong meds. That's not what's happening. What's happening is that we don't have adequate quality controls. We don't have adequate training and education. We don't have adequate accountabilities built in. Not even access to policies and process. So we have reference documents. If we could help them understand that these functions that they've assigned, there are these errors that they've assigned a function to outside of quality risk and compliance are quality risk and compliance, then maybe they can just start associating those dollar values with us.
That is
Yeah,
great.
because the quality team is equipped to evaluate these situations and tell you, well, maybe it is an HR issue, but maybe it's not at all. The root cause is completely something else.
Mhm.
Maybe our processes are failing. Maybe, they're overwhelmed. They don't have time. There could be any number of things that are at the root cause and when bad things start to happen.
Absolutely.
But making a dismissal of it being somebody else's problem is part of that down spiral towards failure.
Agreed. Yep.
Absolutely. It's the blame game that we hear all the time. Point the finger at someone, you have three pointing back at you. And I think this comes from the standpoint of having quality at the table. And I know we have a whole podcast on this and a topic on this, but when you have quality at the table, they're able to identify those blind spots that we normally miss in a healthcare leadership.
Yeah.
I'll be honest, I've missed them myself, but having one of quality at the table to speak to those issues, as Rob kind of mentioned, of those costs going out the door. Well, let's associate it with another department. It's not my issue. Well, it's still money going out the door at the end of the day. If you're a leader, you should be concerned about ways to reduce those overall unnecessary costs and expenditures, whether it's over purchasing medical equipment, that could potentially be used in other departments or used at your local clinic. How can we reduce those overall costs? And you need someone in an organization like Aperitisoft Healthcare that's going to be able to identify those quickly for you, assess those, and reduce those overall incidences from occurring in the future, but also reduce the likelihood that that would happen in other incidences like those in the future as well. And I think that's where you get the win that Gary talked about. You're getting that win. Give us the worst of the worst. If you have a department that's that, and we all know the one department in your organization. We'll be honest. You might not say it out loud, but Rob's laughing because everyone knows the one department that could use a little additional help. We're at Aperitisoft Healthcare saying, give us that department. Let us work with them. Let us help build out those processes that are needed, and let us show you that this actually does work when you put the work into it and you have the right system in place to mitigate those overall issues. I think that's my last word. I'll turn it back over to you, Gary, and I look forward to it.
Well, that was a good last word, Timothy. It was a good way to wrap it up. Thanks again, everybody, for following us here on the After Show. Please follow us on YouTube. Timothy, how can they follow us on YouTube? You have
Sure. I put the link in our chat, but I also added a link on LinkedIn as well, so they can get to our YouTube page just straight from YouTube. It's Aperitisoft Healthcare. They can search it. They can subscribe to our page as well.
If you'd like to subscribe to our newsletter, send an email to insights@aperisofthc.com. That address again is insights@aperitisoft.hc.com. We'll make sure you get an invitation to follow our newsletter. Like everything we do, we ask that you would continue to do that. Comment, give us feedback. Your feedback is very valuable to us. Tune in next month on the 26th. Our topic will be patient safety. So March 26th will be about patient safety. Like this month, we'll be doing a live show and also an after show. Any final thoughts, Rob, before we say goodbye?
No, I loved Timothy's last word.
Okay, fantastic. Thank you, everybody, for following us. We'll see you next month. Bye now.